You know, a lot of people took advantage of the Memorial Day weekend to temporarily escape their homes. You just heard a reference by the doctor to that. But not everyone is being careful about it for sure. Check out this video of a packed pool party at the Lake of the Ozarks in central Missouri. Dozens of people crowding around a pool. Not a lot of masks, not a lot of social distancing. Large numbers of people also flocking to beaches, a trend that worries the nation's top public health officials.
We've made it clear that there's asymptomatic spread, and that means that people are spreading the virus unknowingly. And this is unusual in the case of respiratory diseases in many cases. So you don't know who's infected. And so we really want to be clear all the time that social distancing is absolutely critical. And if you can't social distance and you're outside, you must wear a mask.
Joining us now to take a closer look, Dr. Irwin Redlener, director of the National Center for Disaster Preparedness at Columbia University, also an MSNBC public health analyst. It's good to see you, Irwin. And, you know, you look at these pictures of people on beaches. You take a look at the protests of people who say, you know, it's my right to be out here without a mask. As you're looking across America and also at hospitals who are experiencing now what we who live in New York experienced many weeks ago, which is just every ICU bed filled, having to bring in tents to deal with the problem. What goes through your mind? Where do you see us right now as a country in terms of fighting this pandemic?
Hi, Chris. So, yeah, this is we're in a very bad place right now. I have thought for a long time that it was too soon to rush to reopen businesses and outdoor activities and so on. We're missing tools. We're missing the tool of rapid on-site testing, which actually needs to happen. Nobody should be going into a beauty parlor or a barbershop without knowing that everybody in there working there has been tested today and is negative for the virus. These stories are absolutely chilling and are going to get worse. They are getting worse. And take Georgia, which is the first state to have reopened on, I guess it was April 24th. They had 1,800 new cases over Wednesday and Thursday last week. There's been all kinds of miscounting of the data. It's a random disaster for the country to have these various states opening without being able to do testing. And the second thing they're not able to do right now is contact tracing. Many of the states, virtually all the states, do not have enough people to actually follow up on who's ever positive and make sure that those people are tracked down and tested themselves. It was too early, and I think this is going to prove to be a very unfortunate rush to reopen that the entire country seems to be engaged in now, Chris.
You know, I was looking at this new study at the Imperial College of London. It had predicted up to 2.2 million Americans could die. Now they're out with a new model that suggests that we should be concerned in many states about the rate of infection. But when you have all these different regulations in place, when you have a lot of mixed messaging coming out of the White House, out of state governments, going between state governments and localities, what do we do right now? What do you see as the big priority that has to be done to get this under control?
Yeah, so everything changed on the 24th of April when the first days started to reopen, and now virtually all states are in the process of reopening. And, you know, I thought then, and we put out a report that said you can't actually safely reopen unless you're able to test people every single day and unless you could do contact tracing. And so it's hard to express how disappointed I am that we're in this state now where we're going to be facing significant surges in cases that did not have to be, and we're going to pay a price for that, and the price is going to be in people's lives. And I think we should be reconsidering this right now. If it was up to me, I'd put a halt to this reopening until we get our tools in place. But in the meantime, I think the fact that, as we're just looking at some video images right now, we see lots of people walking around in close proximity, no masks on. So not only don't we have the tools, the testing and the contact tracing, but we also don't have people following the basic guidelines for protecting yourselves and others from getting this really very seriously lethal disease. It's hard to understand what's going through people's minds. But, I think one of the things is, of course, we haven't really gotten really clear guidance from the central federal government, and that leaves the states to be doing whatever they're going to be doing. It's a big random mess as far as I'm concerned.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.